Delegates, we once again welcome you all. The second live surgical demonstration is to be performed by Professor PJW and Dr. Sethi. Before going to the live surgery, Professor PJ will show the building blocks in the laptop, and that is being connected to. Are you getting the picture there?
Yes,
you are getting the picture.
Yeah.
Right. Thank you. Over to Professor PJ.
Good morning, everyone. So this is the building block software. What I'm going to do is just scroll through with you. Dr. Sethi is going to do the right-hand side of this patient, okay? So you can see as we scroll through, the patient's got a very well pneumatized frontal, has got a T3 cell on the right-hand side. He's got quite a lot of disease as we go further back on that left-hand side. It's got an anterethmoidal artery on a mesentery. Okay, so what we want to do is we want to identify the cells as we go. And the first cell that we can see is the Aganase cell. So we click on the building block for the Aganase cell. And then we can just draw the Aganase cell in, and we can then adjust the size of that Aganase cell. And then we can do the same for the T3 cell. So now you can see we can adjust the T, have a good view of that in all three dimensions to work that through. And then we can see we've got a large suprabular cell, which we can then put a building block for that suprabular cell, and then a large bulla ethmodalis behind that. So when we adjust those, we can see that the anterethmoidal artery on that bulla ethmodalis is sitting on a mesentery. We can then look at the suprabular cell and just adjust that, so we've got that into play. Now, once we've got our building blocks done, we can have a look at the building blocks, and you can then see what sort of cells we have: Aganase cell, T3 cell, suprabular cell, and a bulla ethmodalis. Now, what we want to do is we want to draw in the frontal sinus drainage pathway. So we want to come medially with the frontal sinus drainage pathway, just so that we can visualize that. And then we're going to click on the drainage pathway icon, and then we're going to draw in the frontal sinus drainage pathway. Then we're going to go down to the axial scans, and we're going to check that the drainage pathway is correct. So we might just zoom that up even more. And now as we scroll through that, we can see the T3 cell come into view. We can see that our frontal drainage pathway is medial. As we come further, we can move that drainage pathway so we can show that it's medial to that T3 cell, and then it's anterior to the suprabular cell. And then as you go further back, it's posterior to the Aganase cell. So again, just to run through that drainage pathway, in the frontal, coming down, medial to the T3 cell, anterior to the suprabular cell, and then posterior to the Aganase cell. So we've got a good idea of what the cellular structure is of that frontal recess, and we can then understand the surgical procedure that Dr. Sethi is going to perform on that right side. We can also, if we want to now, go further back and have a look at the posterior ethmoids, and see what the posterior ethmoids look like on that side. So we can see that there's probably only one large cell here further back, more posteriorly, and we can fill that cell in so that we can see that cell nicely posteriorly, so that we can then work our way through that. So then behind that we've got we have the sphenoid sinus. You can see the sphenoid sinus there. So we've got a reasonable idea of what the anatomy of that frontal recess looks like. We've followed that frontal drainage pathway. We've had a look as well at the lamina papyracea as we go back, making sure that the lamina papyracea is intact all the way, that there's no dehiscences. You see the significant anterethmoidal artery